So 125 years of Roche. If you have to describe the journey, say what are the learnings and what are the mistakes on the way, if you have to briefly say in like 3 points, what would they be?
So if we're talking about the learnings, we're talking about the support an industry has been able to give to health on a global basis. Our company is one of the leading pharmaceutical companies on the planet. We've been dealing with health and health issue for 125 years. I think the duration of 125 years already gives you an indication that we made better, that we made more good than mistakes. And I think that's one of the reasons why we want to celebrate this. We have a big milestone in our history, and we've called it Let's Celebrate Life. And this is what we've done for the past 125 years and what we hope to be able to do for the next 125 years at least.
So what do the next 125 years look like?
Oh, they look, I think, much more challenging than the past 125 years. The world has changed. We are quicker and quicker at taking decisions. Issues are also coming in our, I mean, the front winds are stronger than they were in the past. And the capacity of our company to reinvent itself on an ongoing basis, to be able to address the needs by the world and by the world of health, is something I'm looking forward to. This is, I mean, I'm not going to be there for the next 100 years, but you know, this is something that we need to discuss and to prepare on.
And I think we can be looking back to the last 125 years and see how the company has time and again been able to reinvent itself, to stay relevant over while the world around it has changed dramatically.
So, family influence on the business. So how do you think you're able to separate the ownership and execution that has been a focus area for you for many, many years? How do you manage to do it?
Well, as you know, we represent the fourth and the fifth generation, and perhaps I reply on behalf of the fourth. The idea that ownership is an active role is something that takes a while to A, demonstrate, and B, to be actually put into practice. So I think it's very important if you plan long term, that you should allocate responsibilities and roles in a way which is as clear as possible. The role of an owner is not the same thing as the role of a manager. A manager needs to go into the details of the implementation of the strategy. An owner, by definition, when it is family ownership, thinks in a more transgenerational way. So you need to be able to dispose and organize things in the long term. In order to be able to best do that, you have to have an understanding of the business which allows you to take the big strategic directions which are going to make a difference.
125 years globally, and the last 2 years have been, quite a bit of change in terms of vision and strategy. So I wanted to understand that at a global perspective also, what kind of directional changes might have happened because of your last 2 years' experience in terms of dealing the pipeline or a change in terms of long-term vision? You've been a cancer, diabetes-focused company primarily, but you're regularly coming out with COVID-related diagnostics now. So if you could give us an idea, and what would that mean for India as well?
So if I can start with the first part for the world, our strategy has not changed. The outside conditions have changed. We've been working on a strategy based on one side on diagnosis and the other side on pharmaceuticals for as long as I can remember. And the idea that diagnostics suddenly has demonstrated its value into how dealing with public health is something that's obvious for everybody to see in the management of the pandemic of SARS-2, COVID-19. We've seen the importance of early diagnosis for reasonable treatment. So we have not chosen to develop COVID tests before the COVID arrived. We just reacted into what the conditions were given. I think in general, the idea of saying one of our operating principles, and I think that's what I would like to underline, is go where the science takes you. So when our different divisions have been able to work together to create some sort of therapeutic solution to a health problem, we've gone that way. So when people tell you, we're strategically deciding to do something, well, let's reality make a check from time to time as well. You need to go in the sense where it's possible to do.
Are there any takeaways from India during COVID? There have been certain innovations. We've been making vaccine in India. So what are your thoughts on role of India during COVID-19?
Well, I think the vaccination program that India has managed to put together is absolutely stunning. This is so impressive how the country was able to get so many vaccinations in such a short amount of time. So I really have to say I'm deeply impressed by these efforts.
I think that's very important to underline and to also understand the purpose of our visit here. We come to celebrate, but we also come to have a look at what the world is doing. And very humbly, what's been happening in a population of 1.4 billion people, it's quite extraordinary. It's quite spectacular. So, as they would say in America, kudos to the Indian, because there's a lot of good stuff happening here.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.